High blood pressure can affect the eyes in multiple different ways. So most commonly, people who have long-term chronic high blood pressure, they develop slow changes where the blood vessels start getting thinner, they start to harden, and then the blood doesn't get to the tissue quite as well, and that does the retina won't work as well. It can cause something called retinal vein occlusion, whereby basically you have a stroke inside the eye that can cause a hemorrhage and vision loss. And then also acutely, if you have a sudden spike in blood pressure for some reason, that can cause swelling of the optic nerve, and that can also cause decreased vision. And in the eye, when we can find these changes, then that is highly suggestive to us that there's changes elsewhere in the body, and that a really thorough exam and coordination with the primary medical care doctor needs to be done.
Did you know that high blood pressure can cause a stroke to your eye? In recent studies, approximately 20% of people have high blood pressure. 20% of people have high blood pressure, and we can see changes a lot sooner in the back of the eye. That's why it's important for us to have a dilated eye exam for us to assess the back of a person's eye. High blood pressure affects the eye by causing the retinal blood vessels to become narrow, thus not allowing proper blood flow to our eye. Due to this disruptive blood flow, a mini stroke may develop in our eye. The only treatment for hypertensive changes in the back of the eye is to have a well-controlled blood pressure. Due to the significant amount of patients living in Canada with high blood pressure, we will co-manage this disease with their primary care physician.
Diabetic retinopathy is the most common diabetic eye disease and is a leading cause of blindness in persons with diabetes. It is caused by changes in the blood vessels of the retina. The retina is the light-sensitive tissue at the back of the eye. A healthy retina is necessary for good vision. In some people with diabetic retinopathy, blood vessels of the retina may swell and leak fluid or blood. In other people with diabetes, abnormal new blood vessels grow on the surface of the retina. At first, diabetic retinopathy may not cause any changes in vision, but over time, diabetic retinopathy can get worse. At first, a person might see spots floating in their vision, or may notice a general blurring of vision. Eventually, diabetic retinopathy may cause vision loss and even blindness.
Hypertension also causes retinal problems. It can cause hypertensive retinopathy. In hypertensive retinopathies, even patient may get vessel blocks like branch retinal vein occlusion or central vein occlusion or central retinal artery occlusion can get affected, which may cause blindness also. Hypertensive patients also periodical eye examination is necessary.